Over 3.4 million people die around the world every year due to water-related illnesses. Most of these are simple things such as worms in water. This number is extremely shocking, and you may ask yourself, what can I do to help decrease this number of deaths every year? The answer is simple. Be a part of a medical mission trip. Whether it means going on the trip, whether you have medical background or whether you don't, or even just supporting it monetarily. Last summer, I was given the opportunity to go on a medical mission trip to Ecuador, which is why I'm wearing this shirt from Ecuador and scrub pants, because this is what we had to wear each day to treat the patients. And we saw over 2,000 patients and treated them all for worms in just 1 week of being there. Before I get into my medical mission trip, I want to explain what a medical mission trip is and why they are so important. On a medical mission trip, there are 4 main stations that a patient will go through. A patient will come into the clinic and initially go through triage. In triage, we take their temperature with a thermometer such as this and ask the patient what is the reason for them coming to the clinic and what is their illness. Next, they go and see a doctor, and the doctor may be using gauze to wrap up a wound, which a lot of places don't have gauze and wounds can get very infected, or they could be doing something like with a syringe or with a bulb, just depending on what the illness is. After they see the doctor, they go to the pharmacy where they're given a bottle of medicine and explained what to do with it. And a lot of times it's medicine for worms, or it's something as simple as an antibiotic like penicillin for bronchitis or other types of diseases. The last station they go to is they go to a station where the people on the team, the medical team, explain to the patients simple things about hygiene. Oftentimes in other countries, they don't understand simple hygiene things that could really help with their health in the future, such as brushing your teeth. And clean water is such a huge thing that many people in other countries don't have access to. But we brought filters with us, water filters, that made it possible for each patient to have clean water up to 10 years as long as they cleaned their filter. This will dramatically decrease the number of deaths in Ecuador next year and the next 10 years because there will not be hopefully any worm diseases and deaths from worms. Another thing that happens with medical mission trips is when you return home, you feel changed and different and very impacted. When I returned home from the medical trip, I just began realizing to not take for granted the simple things such as water and health care. You also learn that you can help people around you all the time, whether it's in another country or here. People may not be informed about simple medical needs in your country or other countries. Whether you are young or old, you can absolutely make a difference on a medical mission trip because you can help at check-in, you can help in the pharmacy. It can be as simple as reading a prescription and handing them the bottle. We also usually have translators on all mission trips so that the patients can communicate with the doctors even if it's in another country. Hopefully, through medical mission trips, everyone can participate and the number of 3.4 million deaths per year from only water-related illnesses alone will decrease. Next, I want to show a few pictures on the screen that are from my personal mission trip, and it will help give you a better understanding of the importance of the medical mission trip and how much it means to people. The first picture shows me personally taking the blood pressure of a woman that is coming in to be treated. Something as simple as that anyone can do, and it's a big help in a medical mission trip. The next picture shows a home that we went to of one of the patients to deliver the water filter and help them with medical needs because they weren't able to walk to the clinic. This home was devastating for me to see because their roof was a simple piece of plastic and about 10 people lived in this tiny dirt floored place. It really puts things into perspective and teaches you to be grateful for the little things. The last picture shows one of the doctors treating a patient, and it just gives you a good visual of what happens and what it looks like to be on a medical mission trip. I encourage all of you to take the time to go on a medical mission trip to help others as well as help yourself. You won't regret it.